Hello, my name is Dr. David McEnany. I have been a surgeon at the Boston Medical Center for the past 24 years. In everyday practice, patients will often ask me what they can do to improve their recoveries after operations. I always encourage them to follow the directions of their care team. That includes the surgeon, the physician's assistants, the nurses, and the surgeon's resident team. It's critical that you're up out of bed after the operation as soon as it is safe for you to do so. In fact, we would strongly encourage you to be out of bed at least 3 times daily, up in a chair or walking, as long as your surgeon and the nurses say that it is safe for you to do so. Your physicians, surgeons, nurses, and therapists will work with you after the operation on various lung exercises. After the operation, you may have some pain at your incision. We definitely encourage you to ask your surgeons and your nurses for pain medications so that you can be comfortable. If it hurts you to take a deep breath, your lungs may collapse, and that can lead to the development of a pneumonia. Your doctors, the nurses, the surgeons, and all of our team will work to make sure that you are as comfortable as possible so that you can breathe deeply after your operation. We would now like to introduce you to our Icough program that has been designed by Boston Medical Center to reduce the likelihood of you developing a post-operative lung complication.
Hi, my name is Jenny.
And my name is John.
And we are nurses here at Boston Medical Center.
We are going to take good care of you throughout your hospital experience so that you will have a safe and speedy recovery from your hospital operation.
You and your family will have an important role in that recovery.
Icough is a slogan to remind you of the simple measures necessary for good lung function recovery after an operation. The first part of Icough is I. The I stands for incentive spirometer, which is a breathing device.
I'll show you how it's assembled. Take this piece right here, piece. Squeeze it onto like this.
It encourages you to expand your lungs to prevent pneumonia. To use the incentive spirometer, put your lips over the mouthpiece, making it seal. Suck in slowly, much like using a drinking straw. The goal is to raise the ball as high as you can and hold it at the level as long as you can. The C is for coughing and deep breathing. After surgery, it is important to take deep breaths often and produce a strong, full cough. This will improve oxygen delivery to your healing tissues. Coughing and deep breathing may cause discomfort, so please speak up and let your surgeons and nurses know if you need more pain medication. It can also help to hold a pillow while you cough and deep breathe. We can help if you are unsure of how to use the incentive spirometer or do not have a pillow to hold while coughing. And please, let us know if you have pain that is not being controlled. We want to make sure that you are as comfortable as possible. The O is for oral or mouth care. Brush your teeth and use mouthwash at least twice per day, even if you are not eating. This will decrease the amount of mouth germs that could infect your lungs. Do this at least twice per day before coming in for your operation and after discharge from the hospital. U is for understanding. The team wants to make sure that you know how important it is for you to take an active part in your recovery.
The nurses at Boston Medical Center will ask you to rate your level of discomfort on a scale from 1 to 10. This will help to understand how you're feeling and plan your medications accordingly. It was helpful for me to ask for medication before I got up I plan to get up 3 times a day before my meals, before breakfast, lunch, and dinner. At first, I could only make it 1 time around the unit, but as I progressed, I made it 2 and 3 times.
G is for getting out of bed and walking. Sitting in the chair and walking in the hallways are an important part of your post-operative care and recovery. You may feel tired during your recovery, but it is critical that you get out of bed even on the same day as your operation. Your nurses will assist you until you can safely do this on your own. If you are not yet steady on your own feet, ask for help. On the day of your operation, you will likely sit on the edge of the bed or in a chair, and you may walk in the hallways. On the day after surgery, it is important to get out of bed, to walk before or after meals, and to sit in a chair when not out walking. The nursing staff will have you sit in a chair for all meals. Even if you are not yet allowed to eat, it is important to get out of bed and sit in a chair in the morning, afternoon, and evening. If you or your family are concerned that you are not getting out of bed frequently enough, please talk to your nurses and surgeons about this.
Initially, after my operation, I felt stiff and in pain. But after I got up, I felt so much better. I was able to get up and walk around the unit, and it was especially nice when my family was there and they could walk with me.
The last letter of Icough is H. H is for the head of the bed being raised. We hope that you are in a chair or walking the hallway as much as possible. However, when you're resting in your hospital bed or sleeping, it is best to have the head of the bed elevated. This will help with expanding your lungs. Your bed has control buttons to raise the head of the bed. We want you and your family to speak up if you need extra help. We are always here to help. We may also apply special boots to your legs that will be worn before, during, and after the operation. The purpose of these boots is to minimize the likelihood of you developing a blood clot in your legs. The boots are connected to a pump that inflates and deflates them to gently apply pressure to your calves about once per minute. This is not uncomfortable. The nurses will encourage you to wear the boots when you are in bed or even sitting in a chair. In addition, you may also want to pump your calves simply by moving your feet. And of course, the boots can be removed when you take walks.
My operation was somewhat unexpected, so it was helpful to have the nurses explain Icough and the interventions involved. Some of the things that helped me the most were the incentive spirometer to help me deep breathe, the pain medicine to help me get up and walk earlier. It was very important for me to be a part of my own recovery.
We hope that this video has helped you understand why the Icough program is so important to your recovery following an operation at the Boston Medical Center. Our team truly cares about your recovery and wants to make it as safe and comfortable as it possibly can be. If you have any questions whatsoever, please do not hesitate to ask your surgeon, your anesthesiologist, the nurses, the resident team, the physician's assistants, or anybody else involved in your care. Thank you for taking the time to watch this video and for the great privilege of entrusting us with your care. We accept this responsibility with a deep sense of commitment and respect, and we look forward to working with you and your family to assure a safe and successful recovery from your operation. Thank you once again.